Thank you, thank you. I want to thank you guys for having me today, and I want to thank Grupo Wetke and the planning committee for setting this great event up. We brought bagels and sweets. I see the sweets went very quickly, so you guys are all kind of like me. But it's great to be here. It's a beautiful facility you have. I actually live down the street near the township building, and I think I want to convince my wife to move here because you got a pool and tennis courts. It looks great. I wanted to actually ask the committee to speak about fitness. So I'm an orthopedic surgeon and I specialize in hip and knee replacement. But what I found myself early on in my practice talking to patients about was fitness. Partially because people would come into the office and they want to know, what they should do, what they shouldn't do. Partially because people after surgery would want to know what they could do and what they couldn't do. So it kind of led me to be interested in, well, how does fitness really affect us and the process of aging? So I've had the opportunity to give talks like these throughout the community, and so I usually try to keep it pretty interactive, but it's a little bit of a bigger crowd. So what I'll do is stop periodically a couple times through the talk and answer some questions, and at the end I'll answer, take whatever time you guys want as far as questions. So the talk is entitled "Staying Young: The Effects of Fitness on Aging." So again, a little bit about me. The reason I came back to Langhorne is I'm a local guy. I went to Council Rock High School. I went to Penn State for college. I went to Jefferson Medical School and did my residency there as well at the Rothman Institute. And I did a fellowship in hip and knee replacement in Alexandria, Virginia, just outside of DC. So I'm with Trenton Orthopaedic Group. Trenton Orthopaedic Group sounds a little funny here in Pennsylvania, but we do have an office over in Floral Vale, and we do go to St. Mary. So moving on, so Plato, the great philosopher, thousands of years ago said, "The lack of activity destroys the good condition of every human being, while movement and methodical physical exercise save it and preserve it." So even thousands of years ago, people knew that the key to staying young and staying active is fitness. So anybody know what this is up here?
Corvette.
Yep, it's the 1953 Corvette. This is the first year they made the Corvette. Anybody know what this is right here? New Corvette, 2015 Corvette. So we put them next to each other, both beautiful cars. Who wouldn't want to ride in one? And so we look at the 53 Corvette and the 15 Corvette. What's the difference? They both drive great, they both look great. One's just a little older, right? Yeah. So what happens over our lifetime, okay? So a sedentary lifestyle, poor nutrition, cigarettes and tobacco. Maybe you were really active and played sports in your 20s and in college, and then life happened. You start working 40, 50, 60 hours a week, you have 2, 3, 4 kids, and all of a sudden you get to 50, 60, 70 years old and you're out of shape. Well, that's what can happen a lot of times over life. And if that happens, it can lead to rapid aging, the effects of chronic disease, and also premature death. So what we want to do is we want to take care of our body so that 53 Corvette doesn't end up like this. Okay? All right, so the World Health Organization has a list of preventable risk factors for death. Tobacco, increased blood sugar, increased blood pressure, physical activity, and obesity, okay? And the combination of these things, or any combination of them, can increase the risk of heart disease, diabetes, and cancer. The 3 things that are the leading causes of death in the United States. So when I look at physical activity being a preventable risk factor, I think that goes with obesity, or physical inactivity, excuse me. I think that goes with obesity, blood sugar, and blood pressure, because active patients can actively control those types of things. So how do we get older? Well, that's an easy answer on one side and a harder answer on the other. So from a chronologic standpoint, you were born in 1950, it's 2016, now you're 66 years old, so passage of time, no way to slow that down. We also have biologic aging. So our body changes as we get older. The changes that occur in the structure and function of the individual cells and the vital organs. So maybe your liver or your heart don't work as well as they did 25 years ago. And so that's biologic aging. So what happens as we get older? Okay, so from a mechanical standpoint, we lose muscle mass and power. Our joints can get a little stiffer. That can lead to arthritis and inflamed joints. From a metabolic standpoint, our metabolism slows, right? So when you were 20, you could eat whatever you wanted and you'd be fine. Now, if you eat, a whole pizza, you're going to be feeling it for a couple weeks. You'll gain pounds quickly. But we lose efficiency in using oxygen as fuel. Our hearts don't pump as much, so there's decreased ability to perform strenuous physical activity. And our bodies respond to stress differently, so epinephrine, which helps our body to get through stressful times, has less of an effect on our body. In addition, our nerves change. So the nerves that are responsible for muscle strength and power decrease in size and amount. And then a sedentary lifestyle can also lead to memory loss and decreased cognitive function. Hormones also change. Loss of testosterone and estrogen, and then a sedentary lifestyle actually decreases your body's ability to produce those hormones that help our body. So, what prevents these changes? Anybody got a wild guess?
Exercise.
You guys are brilliant. Yup, exercise. So that's what we're going to talk about. And so there's a lot of exercise out, a lot of literature and research out there. I'm going to allude to some of it today about exercise. So what exercise should you do? And the answer is it's not just one thing, okay? You have there's an anti-aging exercise program that's really a three-pronged exercise program. There's aerobic conditioning, so cardio, so maybe your water aerobics, your treadmill, your exercise bike. There's strength training, so resistance training, and then there's balance and flexibility. So I'm going to take a couple minutes now to go into each one to know A, what they do to your body, and B, what you can actually do to start those things. So number one, aerobic conditioning. Aerobic conditioning is going to help you because it's going to improve your heart and lung health, and it's also going to increase your maximal oxygen consumption. Which that's kind of a complex formula, but what it's the best measure of fitness of your body. So if you look at marathon runners and rowers and high-end endurance athletes, they have a very high, what's called a VO2 max. And the higher that number is the better your body is able to use oxygen, the better blood vessel compliance you're going to have, and that's going to decrease blood pressure, it's going to decrease sclerotic plaques in your blood vessels. The cardio is also going to decrease fat volume and maintain muscle volume. So the American Heart Association has some pretty good guidelines of what you should do. And these may be a little different from what you might have heard 10 years ago. But they recommend 30 to 40 minutes of cardiovascular exercises 3 to 5 times per week. Now that can be anything you want. If you're an active person and you've been active your whole life, it may be high intensity, like long distance running, swimming, bikes, sports like racquetball. Maybe you're a little lower intensity and you're just walking or just swimming in a pool or doing some kind of lower level sports. But the bottom line is that you do something. And that's the big thing when we talk about fitness programs. I'm sure there's a ton of gyms around here that keep opening up. There's a Crunch by the mall, there's the LA Fitness, and they all kind of start out when you join stressing you to start with a trainer. And yeah, that's making them money, I get it. But the point is to get an individualized program for you. Maybe your knee doesn't move as well as your knee. And so then you need to do different exercises because your knee doesn't move as much. So the individualized approach to exercise is really key to maximizing this, especially as we get older. So now we'll talk about strength training. We're not talking about the Governator here or Drago from Rocky IV. We're talking about more people that look like us, normal people, okay? And in strength training, what are the benefits? We're going to increase muscle mass and lean muscle. And actually it's going to increase your bone mass, which is going to, who here has heard of osteoporosis? So a strength training program actually fights or resists osteoporosis. It's also going to decrease the fat mass, and there's been studies that have shown that people that do strength training programs actually live longer. So the more muscle you have, the more calories you're going to burn, and that's going to keep your body leaner and in better shape. So what should you do? The American College of Sports Medicine recommends 8 to 10 exercises, 8 to 12 reps, 2 days a week or more. And that can be anything. You can do weightlifting, you can go to like a Curves and do circuit training. I assume there's a gym here, I'm sure you can do exercises here. But in addition, you don't necessarily, not everybody wants to go to a gym, or you guys are busy, not everyone has the time to go to a gym. So you can do things at home too. You can do just regular push-ups or lunges in the comfort of your home. You can get a workout video that you can follow. You can even get things that like big sporting goods, like a Bosu ball or a medicine ball or resistance bands. Anybody ever heard of those things? Yeah. And those things can also help as far as strength and resistance training. So you don't have to go be in a gym bench pressing 300 pounds. You can really modify it for you. Next we have balance and flexibility. So the benefits are going to be that if you do balance and flexibility type exercises, you're going to maintain range of motion, you're going to stretch your muscles and your tendons, and that's going to help to limit injuries like strains or tears of muscles and tendons. It's also going to help with your posture, and actually the stretching and flexibility exercises will release endorphins in your body, which can help with pain actually. It's also, as we get to a really old population, if we improve our balance and flexibility, it can help prevent falls, which can certainly lead to fractures and things like that. So what should you do? So you can do sustained stretching. That's pretty basic, what you learned in gym class as a kid, right? Sit and reach your toes. You can do dynamic stretching, like jumping jacks, things like that. There are tools you can use, like a foam roller. And then you can do classes. I'm sure you guys have access to yoga or Pilates either here or close by. And those are great exercises if you can do those to help with balance and flexibility. So an anti-aging exercise program, we've kind of gone through a detailed one here. Now what's it really going to do to your body? So the mechanical stress from all the exercises you do is going to improve strength and power and increase your muscles activation. And it's also the metabolic stress is going to, the high intensity exercise is going to increase your metabolism. So basically your body's going to be working more. And what that's going to do, that's going to stimulate the endocrine system, the system that produces the hormones, to produce more hormones. So testosterone, growth hormone, and insulin-like growth factor. Now this isn't the steroids that Barry Bonds and Mark McGuire were using. These are natural versions of those, and the natural versions are very safe, and that's what we can do to get stronger. They're naturally produced in the body, and they support and promote muscle and protein synthesis. They also stimulate your cells to build new muscle. So that's kind of the end result of an anti-aging exercise program. You're going to stimulate your body to continue to get the body in better shape. Now the question people always ask, well, can it work for me? And there's actually tons of studies that say yes, it can. So they took men between 59 and 72 and men in their 20s. And the men in their 60s responded the same way to a high-intensity exercise program that the men in their 20s did. They took older women, okay, and they found that they could increase exercise intensity at the same rate as younger women in their 20s. And they've also found that men and women in their 60s and 70s can see similar gains in strength from the same exercise program. So just to prove it to you that it can work, is that just like you had elite athletes when you were in your teens and 20s, you have elite older athletes these days today. So who here has heard of the Ironman? Okay, that thing where they do the swim, the bike, the run. It's actually the fastest growing age group in triathlons is actually people in their 40s and 30s. More than 50% of Ironman finishers are over 50 or over 40 years old. And actually every year Ironman records are being set by people greater than 65. How about something closer to home? New York Marathon. Anybody done that? Yeah, I would do it. A marathon is too hard for me. It's too long. But it's a great exercise. And what a study did was they took 900,000 marathon runners, okay? 25% of the people in their 60s had faster times than people between 20 and 50. So the people in the 60s were beating 20-year-olds, okay? In addition, marathon times for men and women continue to improve over the last 30 years. So people always want to know, well, how do I get started? I always say, first talk to your trainer, make sure any medical conditions are looked at, and make sure that you're safe for exercise, basically. And then number two, I say, don't go alone. One of the best things you can do is exercise with a friend. Sometimes that's a trainer, but sometimes that's like a neighbor or a friend. And then you kind of have some accountability and it becomes more fun. So definitely it's not something you should undertake alone. Definitely have a partner or a trainer that helps you. And they can also help you be safe and make sure you're doing exercises with the right form and things like that. So in summary, an anti-aging fitness regimen is going to have cardiovascular exercise, strength training, and balance and flexibility. And that truly is the fountain of youth. All right. Good. So this is probably one time we can take a break because we're going to transition over to arthritis. So if anyone has any questions on fitness and aging,